The following is brought to you by CHI St. Vincent.
Welcome back to Good Morning Arkansas. Dr. Srinivas Vengala this morning of CHI St. Vincent in Hot Springs is here to join us to talk about Heart Month and the upcoming Hot Springs Heart Health Fair. Good morning, Doctor.
Good morning.
Let's talk about heart health in Arkansas. Where do we stand concerning, really where we sit with the rest of the country?
That's a very important question you asked. As you know, heart disease is the #1 killer.
Yeah.
And in the U.S. and even in Arkansas. About 7% of adult population in Arkansas has heart disease.
7%, that's a really high rate.
Compared to 4.2% in the nation.
Why is that?
There's a lot of factors, obviously, diet, lifestyle, and then the educational levels and all the stuff.
So we need to be more aware of some of the things that may raise our heart health risks.
Absolutely.
Well, what's the best, how's the treatment for heart disease changing here in this state?
Oh, significantly. Like over the, let us say, last decade, we have really seen significant improvements. Especially at CHI St. Vincent, we have always tried to adapt the latest technology with the almost large network of heart specialists we have.
Yeah.
Recently, we have been seeing a good outcomes with minimally invasive procedures like TAVR, where we fix the aortic valve.
So minimally invasive, these are outpatient surgeries?
Essentially like overnight at the most.
Yeah.
And they're home, and no open heart surgery.
No open heart surgery. So that's pretty important.
That's very important. People love to have not to cut open the chest and get it fixed.
That's right. It's the recovery time not quite as bad either.
Not quite at all. Not at all. Compared to 4 to 6 weeks to 4 days.
Well, let's talk about what are some of the best things you can do for your heart, of all ages, really.
I would say heart healthy lifestyle is a single way of putting it, of which diet and exercise matter a lot.
Diet and exercise. So when you say diet and exercise, let's be a little more specific. What should my diet consist of? Obviously, you don't want to eat, I guess, the non-heart healthy foods every single day, but you want to be in moderation more?
Exactly. Like what I was trying to say is, in diet-wise, try more plant-based with minimal meat, less often, preferably not if possible, but plant-based diet and with exercise has really shown improvement.
Off the top of your head, what are some of the healthiest things you can eat?
I would say like lentils, legumes, green leafy vegetables, fruits.
Yeah.
These are the most.
Fruits and vegetables. Maybe incorporate a little bit more of that into your diet.
Plate.
All right, well, the Hot Springs Health Fair coming up this Friday, Valentine's Day. Tell me a little bit about that.
So, as we know, Valentine's Day is a very important day and deals with the heart. And we are trying our best to make everyone have a healthy heart to take care of things. And at CHI St. Vincent Hot Springs, the Heart of Hot Springs Health Fair is this Friday around 1 to 3 p.m. All the cardiologists will be available to talk to people from the community and answer their questions, give them all the advice possible for the healthy lifestyle. Even we have our dietitian team will be there. I'll be on the panel with 5 other doctors available to talk to them.
So you can talk to anybody if you drop by and any question, whether you're heart healthy or you may already have issues.
Anything, yeah. It's like you get a chance to spend like a couple of hours directly interact with everybody.
And I guess the best thing you can do for yourself going forward is staying aware of maybe things that could raise your risk.
Absolutely, yeah. Regular medical checkups where they can diagnose the diabetes, hypertension earlier and manage it.
Let's talk about regular medical checkups. What age do you want to start doing those every year?
I would say earlier the better, at least from 3rd decade of their life, they should start having.
So about 30 years old, you should start doing it every single year?
Absolutely.
And during those checkups, I guess you can detect some of the early issues?
The main risk factor for the heart disease is hypertension, diabetes, and high cholesterol levels. If they can be diagnosed early, and you can prevent the disease.
So you can completely prevent
the disease,
if you catch it early.
Definitely.
Okay, so you want to have those checkups as you go through.
Absolutely.
All right, well, the Hot Springs Heart Expo, that's this Friday, 1 to 3 p.m. That's at the hospital there?
That's right, 1 to 3 p.m. at the hospital.
All right, hey, it's a good time to think about staying heart healthy. We are in the month of February, of course, Valentine's Day.
Yes,
Friday as well. Before you head out Friday night, maybe stop by CHI Hot Springs. Doctor, thank you this morning. Thank you for the good information. Anything else you want to add?
No, thank you for having me. And as I said, start at least at first step, diet. Watch what you eat and be active.
Very good tips this morning.